Welcome to our fourth mini fair AEP for 2026. I am your host, moderator, director of development, Kimball Torres for SCAASF. We are very enthusiastic about our presenter today, who will be focusing on motherhood and the racial disparities you find in our communities. He will also be talking about the importance of other people taking care of sickle cell patients besides just the sickle cell patient community. Very, very enthusiastic, very, very pumped up to have Andre Aikins with us today. So let's give it up for Andre for coming today. As we get started, something to help us focus in, we call it the moment to arrive. And we will go through that little transition that we do to get ourselves focused, ready mentally, and in tune with what we want to do. Because sometimes we have hectic mornings, we've had a crazy week. It being Saturday, it's a good practice for us that we've learned is very, very effective. So what I want us all to do is ground our feet, put them completely flat on the floor. Take one deep breath. As you're taking a deep breath, I want you to close your eyes and hold that breath in your lungs. So here we go. Eyes closed, taking a deep breath. As you're taking that deep breath, think of everything that happened in the week, both negative and positive, chaotic, non-chaotic, uniform. And as you breathe out, keep your eyes closed and breathe everything out. Let it all out in your breath, all those thoughts, ideas, energy, whether it was good or bad. Then I want you to take another deep breath in. Keep your feet grounded. And as you're taking your breath in, just open yourself up to the breath, to the experience, to everything new we're about to learn and hear. And as you breathe out, open up your eyes. At that point, put yourself into a comfortable position and be ready to ride a great train of education that we're about to embark upon. Thank you for coming with us. Thank you for participating today. Thank you for participating in the moment to arrive. Hopefully that helped you guys ground yourselves. A couple of announcements. We want to make sure that all cell phones are silenced or put on vibrate so that we do not interrupt the presenter as we go along. If you would like to take video, that's totally fine, or pictures. You are more than welcome to do so as well. If you do post it on any socials, make sure you tag us, SCAASF, on any tags that you do from today's presentation. We will also have a survey that we will send to you at the end of the presentation today so that you guys tell us how we did today, the goods and the bads. It's always good for us to know how we can get better, because the only way we learn and grow is by having people telling us what we need to do better or what we've done well already. With that, we want to make sure that we are all very respectful. As a moderator, I will field any questions when questions come. During the presentation, if you would like to, you can raise your hand and Andre will go ahead and address that question at that time being, or if you want to write it down or put it on your phone and ask the question later, we will have a Q&A at the end of the presentation. We have two parts of the presentation. The first one will be roughly around 25 minutes, at which time we will break. We will have lunch at that point, and then we will start again with our second segment after that. And at the end of that segment, we'll have a Q&A for the whole presentation together. Any questions at this point in time before we get rocking? Awesome. So I would like to take this opportunity to formally introduce our presenter, Mr. Andre Aikins, representing Rafiki Wellness. He is formerly a math teacher and assistant principal at Frick Middle School and Madison Middle School in East Oakland. Andre has managed the day-to-day operations for Alive and Free and teaches personal development in the community. He has 20 plus years of experience with youth from all walks of life, as well as those who are at risk. His dedication has earned him numerous accolades, including the 2015 Man of Merit from the Delta Project, the 2011 Community Service Award from the Sociology Department at Grambling State University, a 2008 American Education Week Certification of Appreciation from the Department of Education at Grambling State University, and a Certificate of Appreciation from the McCullough Youth Court, which is from 2006 to 2007, among many other accolades as well. Andre leads workshops, presentations, and training sessions, collaborating with community partners to advocate for youth and support formerly incarcerated individuals. He is committed to promoting healthy lifestyles across the Bay Area and beyond. Andre holds a BS, a Bachelor's of Science in Mathematics Education, with a minor in Sociology from Grambling State University, along with both an administrative and teaching credential from the state of California. Without further ado, I present Andre Aikins.
To speak to you today and with this topic. First of all, let me just say I don't want to offend anybody at all, but I do believe in Jesus Christ and God as my Savior. So I thank God every morning that I wake up, draw breath, and for the health of myself, my family, and the people that I'm connected to. So I want to just give honor to God for being here today and having the opportunity to share today. I have been blessed to have had an interesting life that led me into the position that I'm in right now, where I can give back, where I can connect people, where I can concentrate my efforts on making sure that nobody had been subject to what I was subject to or make the choices that I've made, and to be in place to have resources to assist people wherever they are on their continuum of their life. And with this organization that I'm glad that I'm here to speak to, there's a connectedness. And the main thing within that connectedness that I want to say is I am so blessed to be Black. I am so happy to be Black at a time in this particular country where being Black is really, I will say, being attacked locally and on a nationwide. But I will also say that the energy in this country is around attacking anybody that's not like the dominant culture in this country. And it shows up in many different ways. And we have to work within ourselves to make sure that we're okay so that we can be engaged in the overall battle that's taking place. If anybody flown on a plane before, it is very important to notice what the stewardess says. When the life mask, oxygen mask come down, you put on yours first, and then you assist somebody else, because you're no good to anybody if you're not healthy or you're not taken care of. I didn't realize how important that was until I started working for Rafiki. Um, I grew up in East Oakland, got into a lot of trouble out there, and by, again, the grace of God, my plan on this one particular day was I was attending Castlemont High School for summer school to get a driver's license so I could get my car out of impound. That's the only reason why I was there. And hey, I was looking towards the future. So, but after school, I would go to 96 and Cherry and sell dope. And so this one particular day, I got the English was not my best class. And so that was one of the classes that I had to choose along with driver's ed. You needed 2 classes to go at the time. So I was like, man, as soon as driver's ed is over, I'm hitting the back gate and I'm going over to handle my business. And that was on that particular day, I got introduced to an organization at the time called the Omega Boys Club. It's now known as Alive and Free Street Soldiers. And that changed the trajectory of my life on that day in that meeting. I won't spend a lot of time on that, but we can talk about that a little bit later. Again, an organization that was in place to assist individuals and help them came out and changed the trajectory of my life. I want to let that sit for a minute because it is people helping people that help us get to the next level, or to open up doors for us, or to change our perspective, or to give us opportunities that we normally wouldn't be exposed to. And so that day put me on a trajectory to become a math teacher, then an assistant principal, and now director of programs at Rafiki Coalition for Health and Wellness, and a whole lot of stuff in between there. Within my 30 some odd years, is that I got to update my introduction a little bit because there were some dates on there and I was going, whoa, that was some time ago. But during that 30 years of service, I realized something just yesterday, that I actually worked for what I would call a regular job. I've only done 2 regular jobs besides being in the service of others. That was working once for FedEx and then once for UPS. My whole entire working career has been in the service of others. And again, I believe in God. That is a blessing. I believe that that is a blessing. And so my journey to work at Rafiki and changed again the trajectory of my life, because I didn't understand at the time about health, wellness, and how much that leads into us being in a position to not only service ourselves, but to service others. And so I just took health, being able to get up every morning, go to the gym, work out. I wasn't on any kind of medication. I didn't have high blood pressure. I didn't have any of those things. So to me, that's where health was. My mental health, I did not, I looked at mental health probably in the format that a lot of people in our community look at mental health, or had at one time looked at mental health. That it was, man, if you need to talk to somebody, you need to go to the crazy house or something of that nature. And I'm not going to go talk to nobody and tell them how I'm feeling, because as I was raised, men don't do that. Black men suck it up, hold it in, don't cry, don't be and moan about it. Just tie up your bootstraps and go through another day. Don't and to get in touch with our feelings and our emotions was looked at as being weak. And so that was the framework that I had um, around mental wellness, mental health. And whenever I heard wellness, I associated it with mental health and associated that with having some kind of issue with you that that was negative. It wasn't. It was your problem. And so when I began my career at Rafiki, it actually started during the time of COVID, and I came on as associate director and was in charge of the COVID response for the Bayview, Hunters Point area. So we took community members and we had them work with community members to get people tested. If they were found to have had COVID and needed to quarantine, we would help them with PPE, and we would help them with groceries. We would help them with a number of services that now they wouldn't be able to engage in until they um, were in a healthier state or tested negative for the COVID virus. Through that work, I started to realize what health and what a healthy community actually looked like. My at the time, my thoughts on health was, we got to stop killing each other. That was my thought. We got to stop hurting each other, and we got to keep the family together. I learned that it's way more broader than that, and that um, whether people want to admit it or not, our health is a singular line through everything. If we don't eat, we're not healthy. If we cannot breathe, we're not healthy. If we're not communicating and we don't have family engagement, we're not healthy. If I don't have a place to live, we're not healthy. If I don't have healthy connections, we're not healthy. The health goes into a lot of different areas that I didn't realize until I started working here. And in doing so, I learned also that mental health is a big part of us being healthy. The ability to understand why we make the decisions that we make, to understand if we have some kind of psychosis that we cannot help, that we need outside intervention for, to understand that there's nothing wrong with sitting down talking about, I had a rough day, to sit down and talk about, you know what, I finally realized that the pain of losing my father when I was 15 impacted me and still impact me to this day. Understanding that the relationship between my mom and myself guided me in terms of how I developed my relationships, whether they failed or whatnot, as I move forward. All of those things are connected in us as individuals being healthy and for a healthy community. So there are a number of facets that that need to be in place and taken care of for us to have a healthy community. And that's why it makes sense for Rafiki Coalition of Health and Wellness to partner with the Sickle Cell Anemia Awareness organization, because this organization cares for people with something that directly affects our community. And without that support, a lot of people would be in an unhealthy state. And so in an attempt to make sure that we are a full service organization to assist everybody, it makes sense for us to partner with other organizations. And so what I want to do at this point is take this setup, if you will, of why we're here in this room and what brought me into this space right here to give this presentation. I want to talk a little bit about Rafiki and how it connects. Yes, ma'am. Yes.
What does Rafiki stand for? I mean, what does that mean? What is that?
Yes, that is actually, there's a symbol, which means unity, and Rafiki is Swahili for unity. And so if you notice, if you look up that sign, you will see it all over the internet. And it is that logo rests with a lot of different organizations, because they're part of their mission, in whatever organization it is that this symbol represents. It's about bringing people together. It's about having a collective. And so a little history about Rafiki, and I'm glad you asked that question, because it wasn't always named Rafiki. In the beginning, 40 years ago, it was called the Black Coalition Against AIDS, because when the AIDS epidemic started 40 years, well, not started 40 years ago, but when it was very impactful and it was really exploding, the Black community was left out of all research, all support, all systems, or whatever the case may be. There was no advocacy for, at the time, Black gay men that were suffering from AIDS. And as it started to really impact the community and spread, there was um, uh, 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 people got tired, if you will, of going to people who had no interest in helping and said, we got to help ourselves. So they came up with the organization, the Coalition Against, the Black Coalition Against AIDS, to bring medication, awareness, support, connections, policy changes, advocacy, all of those things that were needed, so that the disproportionate numbers of Black men that were dying from AIDS and Black women, and the impact on the entire community, can get serviced or have some kind of impact. So as they were doing that work, years down the line, they discovered that, hey, the AIDS epidemic in our community is a symptom of a much larger problem. Just like when you sit down and think about community violence is a symptom of a problem. It's not the only problem, and it's not an easy fix, because there are many different things that are taking place. And so we cannot address AIDS if we cannot address somebody's living condition. We cannot address or help somebody change their sexual habits if they're worried about whether they're going to eat, if they're worried about whether or not their kids are going to make it to school, if they're worried about getting shot, all of these other things that have to go into, that goes into a person in our communities in terms of surviving day by day, worried about who I'm doing it to and whether I have protection isn't on the top of the list when I'm worried about where I'm going to put my head at. And so when they realized, hey, we got to address this as a full service issue, that it is just a part of what's going on, then it was, how do we open this up? How do we address all of those needs? Well, the first thing they had to do was go through some rebranding. And they had to look at the organization as being an entity that will service a person no matter where they come in at, what their issues are, but there will be no turn away. There will not be a situation to say, we don't do that here. We have to be all inclusive so that we can get to the goal of bringing down the number of infections due to HIV infections. And so now that you can eat, now that you are housed, now that you have mental health services, now we can deal with this issue too that you put on the back burner. I would just say real quickly, within the last 2 years, one of our initiatives have been the Emoja Health Access Point, which directly works within the Black community to impact the infection rates of HIV, STIs, Hep C, and a number of other items, or a number of other issues within the Black community. Within doing that work, we partner with a lot of different organizations. I'm sure everybody have heard the analogy where if you got the wood, you got the nails, I got the hammer, we're gonna build this house together. And that's the approach that we have to take. Now, find out what you do good, zero in on that, and then bring somebody else in for what they do good and have them add to this gumbo of help, if you will. And so that gives us the ability, and I will take credit for saying this, what I term and what I challenge my staff to do is we never will say no to anybody who walk through our doors. We will say we don't do that, but we can put you in the hands of somebody who do. Nobody will ever be turned away not knowing or not being connected with a service that will help them. If we can put ourselves just into that space and into that mode, we will be able to have an impact all the way around on the individual. You impact the individual, you impact their family, you impact their family, you impact the community. And so the ability to, and there's this term, and this is another term I came up with, that people come off with, which is, now this isn't my term, of course, but the warm handoff. We're going to hand you off to somebody. We're going to connect you. I thought that was terrible in my mind. So I came up with the term a warm connection because I'm never going to let you go. My thing is to put you in the hands of somebody else that you can trust, somebody that's going to service you, and I'm going to be with you through that journey wherever it takes you at. So that's another thing that I got my staff, and actually I'm proud to say that the Department of Public Health is using that term now too. Warm connection and not warm handoff. Because just the sound of that to me was not that was happening, but just the sound of it was opposite of actually the work that we do and what's taking place. Warm connection is more of what happens because we call people and check on them after we have them engage with another organization. We have hands on them in terms of want to make sure that they make the connection, or if they didn't, they would come back and say, hey, so we never really lose connection with people. So why do we say handoff? Nah, we're gonna say connection, and that's gonna be where we land at and where we stand on. So again, with that as a backdrop, warm connections and that we never say no to anybody. I want to talk a little bit about Rafiki and the organization and some of the things that I learned since I've been here and have been blessed to be instrumental in assisting. As a wellness organization, our job is to advocate and provide services for an entire person, whether it's about nutrition, exercise, mental health, family support, whatever that looks like. And I am proud to say that some of the work that we do is directly related to mothers in the Black community and supporting mothers post and pre and during the raising of the children, which is important. And I do have, I'm a troublemaker, let me just say. And I do speak my mind. And so in the community, most people will say he's a, but he will tell the truth. You know, you're not gonna get no bull from him. If you cannot take straightness, then that might not be the person you want to work with. Because if it ain't right, I'm gonna call it out. And I'm real big on, if you're supposed to be servicing our community, you need to service our community with dignity, respect, and do what you say you're gonna do. And if you're not, I ain't got time for that, because we are in dire straits. And I'll get to all of that. Whew. I can get started on that. But with Rafiki and our mission, so here, Rafiki's mission, Coalition's mission, is to eliminate health inequities and inadequacies in San Francisco Black and marginalized communities through education, advocacy, and by providing holistic health and wellness services in a culturally affirming environment. So if people don't know, I think I mentioned this earlier, but I'm Black and I'm proud to be Black. And I don't think it's a crime to be Black. I don't think it's a crime to be any ethnicity in this country. But I do understand that cultures have certain things that they need. And one of the things within the Black community that comes along with doing this work is this undertone that we have to share and we have to do all this, which I am not against, not at all. I'm not against working with other organizations and other groups from other cultures or anything of that nature. So I want to make that clear, because sometimes people take what I say and run off with it. But what I am saying is, being a Black man, I prioritize Black people. And I work to make sure that they have what they need so we can come to the table equally, share equally, work together equally, and that we are treated in a manner that we deserve to be treated. And a lot of times in the city, they make it bad to be Black or to work with Black folks. And to be completely honest and transparent, and I actually said this to the director of DPH, when you have initiatives for Black people that's supposed to prioritize Black people, but then you cannot put Black on your folders or on your flyers, or you have to not prioritize the community that they say you're getting this money to prioritize, I feel that that's a problem. And I feel that we're one of the, if not the only group that has to make these accommodations for everybody else, where there are other events and other organizations that deal with just their folks and not only their folks, which is fine. That is not a problem. My only problem is, how come we're not granted and afforded that same, that same care? They have, there's in Daly City, I drive past sometimes, this hospital for Chinese people, which is fine, because they need people that speak their language and all of that and sensitive to what their needs are. We can't have a hospital for Black people. So, and again, it's not an accusation, but it is to say that we need to prioritize what we say we're going to prioritize and work in that vein. And I should not have to say Black quietly. I should be able to say, I'm proud to be Black. I'm doing this for Black people, and not have to shuck and jive and hide the fact that I'm working with Black people because I got to let it seem like I'm working with everybody. It doesn't make sense to me. So, yes.
And I know when we talk about addressing and talking about different communities and stuff, being politically correct, which is a phrase that I personally do not like at all. But using the term Black versus African American, what would you say would be more resounding to use, would be a better way? To me personally, I like using the term Black, but sometimes, when I'm in a different avenue, like you said, you mean African American. I'm like, no, I mean Black, but
Yeah. Long as nobody calling me an MF or an N, I ain't tripping. I'm good with Black or I'm good with African American because I am African in America. I am Black, and I grew up being called Black. All my documents said Black. So I'm not opposed personally to either one. But I do know, depending on the crowd that you in and where you go, you got to be able to code switch. And sometimes certain people in the room feel real threatened when they hear Black because Black has all this, to it. And so sometimes, well, African American, if that's what you need to hear, So whatever the case. Yes, ma'am.
I work for the Alzheimer's Association and DEI. We've not gotten rid of that at all. And the reason that we're using Black/African American is because you can be Black in the United States and not be an African American. So it's back to what you were saying, the politically correct. Yeah, and that's what that's all about.
Thank you for bringing that up because there's a lot of purposeful driven discourse around foundational Black Americans and immigrants and all this. And I believe that there are some differences in culture, but I do believe that it is purposely thrown up there to separate because nobody gonna say, oh, well, you a Black person from over there. They're gonna call you an N, period. So we gotta get away from that, but I understand that that's another trick of the system to have us do this rather than do this.
Right.
So, we gotta we gotta read the room. We gotta know what's going on. And we had an event over at our HAP, Emoja HAP clinic. And there was this sister who was there who said, well, this is great. This is fine. But I'm from Nigeria and I want to be included in being in African American. So, my thing is, you Black and you in this room, you included, so I don't see what the issue is. That shouldn't even be a question, So I didn't get a chance to walk over to her and say that. But I am going to, if she comes back, like, look, you got to let that go, because if you feel that you're outside of that for whatever reason, because some people feel like it's better to be detached, I'm going to get something out of it versus, or feel like they don't want me over here. Like, nah, we got to get away from all of that and realize that under the umbrella that we're all the same. And it's to some people's advantage to have us doing this constantly. When we talk about Black and marginalized communities, again, let's look at the analogy that I started off with. If we can't save ourselves, how can we save and partner with somebody else if we got all this other stuff going on? Not to say that two things can't be done at once, but whatever we doing haven't been working. So we got to look at how we go about doing things, how we strategize about assisting our community, and do things, in my opinion, a little bit different, get our foundation underneath us, and then that'll make partnerships and strengths outside of the culture that much stronger, which allows us to do more of this. Because if I'm so fractured over here, but trying to partner over here, then that's just like trying to build a house on sand. Sooner or later, it's gonna cave in and all this stuff. So we can go to the next slide. So relationship-centered village building. We have had a number of people that have come through our doors that actually became employees of the organization or independent contractors. Wanda Green is a wonderful example of that. She was homeless and living in the parking lot of our main building for a while. And so she got, when we were doing the COVID work, we were able to employ her. And from there, she used the resources of the organization to get on her feet, get housing, get another job, and she's doing very well right now. She was on my staff when I first started working for Rafiki in the 94124 COVID response work that I was doing at the time. But she's an excellent example of somebody who, when you invest in and you service all of their needs, then their potential can be seen, because then they can concentrate on other things besides just day-to-day survival. So this is a more extensive interview with her. If somebody would like these slides, I can provide this with you. But she basically told, this is her story here that she was telling.
You want me to read the first paragraph?
Sure.
Wanda Green, A Story of Resilience and Emancipation. I had a drug addiction problem for about 5 years and I lost my place. I went to programs seeking healing and did everything they asked and followed the rules. And I fought my addictions only to be told at the end that I had to leave because they needed my bed for someone else. I became homeless. I want to share my story here to show that I did not just become another statistic out there succumbing to addiction and homelessness. I want to share the story of how I found myself, my self-esteem, and motivation. I'm now employed by Rafiki and have housing and have been drug-free for many years. If I can do this, anyone reading this story can as too.
So again, having that ability to not say no, having the ability to put an individual in the hands of somebody else to deal with some things that we may not be able to deal with, but still stay connected to them. The model works, full service model. And so again, I will fall back on, that's why partnerships are so important, because we have to be able to turn to other people who specialize in things that we don't specialize in and put them in good, capable hands that's going to care for them. So this is a number of the services that we provide, and we actually have a few since this slide was made that we have added on. So we have wellness navigation, complementary medicine, which is our acupuncture, massage, chiropractic work. We also, with our acupuncturist, also does the cupping. I never known what that was until he came, but it's basically using cups to absorb pain out of you. It's different, very different. We have individual and family mental health therapy, and let me come back here. So under our family mental health therapy department is where our embrace and our work with mothers rest at. So within there are groups to help mothers deal with the pressures of being a mother, whether it's single or in an entire family. It helps deal with the pressures of postpartum, the things that women go through after they have the child. And sometimes there's things that's going on that they don't even understand or know about, but how to assist and help them in that manner. And also how to figure out to work within a relationship in a healthy manner, whether you're with the father of that child or not. How are the two of you going to exist in a manner that's going to be best for that child? Or is it a situation where you have to cut all ties off because it's just too unhealthy of a relationship to maintain anything? I want to put a pin right there. real quick, because within the grants and the stuff that we get, there's a flaw in it. And I don't think that it is non-intentional. I think it's very intentional. If we go back and we look at governmental housing and assistance programs that were supposed to be in place to support people, it actually tore families apart. Because you could not have a man living in that house to receive any kind of government subsidies or assistance. And that still is to this day. So the man had to leave the house, and if you put the man out or the man chooses to leave, then we'll give you whatever assistance you need. And in my opinion, the people that need, or the group that need the most, are the middle class, because we fall right in there above what they would call poverty, but below living wage. So we got to figure out all this other stuff. So there's this one too. But these programs that they have, even city implemented for working with mothers, exclude fathers. And there is direct language in there that says fathers are not able to come into these spaces. So if you have a father that want to come and support this work, or need to learn, how do I help support my wife or my girl, or whatever the case may be, for some issues that's going on that's outside her hand, I can't even come and learn that from the experts. I got to let her tell me. And sometimes, communication can be something going when things are going on. What resources can I have as a father? There are very few resources for fathers that are out there just for fathers. Some, but not a lot. Not to the number that it is for mothers. And again, I'm not coming from a perspective of we need to do away with that. I'm coming from a perspective of, and we need to do. But again, what does that do for the coming together? What does that do for what's necessary to raise our children as effective as possible? And again, it's not saying, okay, you need to be husband and wife, or you need to have a healthy relationship. If you don't get along, you don't get along. But that doesn't stop you from being parents. You don't have to be lovers in order to be a good parent. That's not necessary. Yes.
Just so everybody knows, those policies that you're directly talking about and how they got instituted is based on statistical data that they gather, which is institutionalized to make sure that individuals stay individuals, because what they use with the demographics of racial abuse is they tend to skew lighter skin or people of money out of those statistics, and actually find that people from poverty or middle class usually tend to be either brown or black that are culprits of being abusive. Right. Therefore, that's why they can institute these policies in order to just help the women's side of those. But then, like you said, it doesn't help bring families together. It actually helps them separate them out more, to add more statistical data to back up the fact that they are actually being institutionally racist. So that's a fact that everybody needs to be aware of, is the fact that they actually are using our own stats against us to actually perpetuate the cycle.
Yes. It's a catch-22. It's a catch-22. And so that's why it is incumbent upon us, again, with that analogy, to save ourselves. Because even though I do enjoy comic books, watching Marvel and DC and all that, no superhero gonna fly down and save us. We're gonna have to save ourselves. Iron Man ain't coming and all this other kind of stuff. So this, if you want to, we can take a break.
Time for Andre, everybody. Very informative. Great stuff. This concludes our presentation for today. It's been my pleasure and honor to be your moderator for today. It's been wonderful to hear from Andre and all this great information that we have, especially today, the day right before Mother's Day. Before we get going with my final closing remarks, we're going to have one little fun event that Keisha Johnson will be in charge of today. This will be the raffle. Let's see who the lucky winners are for today.
Please excuse my ratchet.
Sometimes a lot of guys don't have role models or don't have educational output in order to learn how to support a woman, a strong woman, especially in this day and age. So, you know, they're either intimidated or taken aback or try to instill their own power, and it just doesn't work out very well. So definitely agree in terms of being able to support mothers. We definitely have to be able to get educated ourselves in how to support them better. As a reminder, we will send out the survey to you guys about today so that you guys can give us some feedback, what things you liked, what things you did not like. Again, it's very important that you go check in with Keisha at the registration desk or sign up with us on the registration desk if she's not, because I think she needs to get going in a couple of minutes here. So either check in with me or Nadina to get yourself on our emailing list so that we can get you guys that survey and also future information on us. As I said, it's been an honor, pleasure, privilege. We will have another AEP session in August. Before that, we are going to have our annual Juneteenth celebration over in Oakland at the World Sickle Cell Day as Juneteenth over in Oakland at the Infirmary. We will email you those details. It is an outdoor event. We usually expect anywhere from about 100 to 200 people. Should be fun. Lots of food, lots of guest presenters, a lot more informative booths that will be set up for both health and wellness, and also in terms of sickle cell disease and what we can do to help out the community in that respect. After that, we will have our AEP in August, and that'll be the second Saturday in August. I don't remember the date exactly right now, but after that, we will have our flagship event, which is known as the Sickle Cell Walk and KMJ Health and Wellness Expo, yes. September 12th, and that'll be from 9 to 2 p.m. That is what we've done for the last 13 years of our existence. It is a fun event, awesome event, community building event right here in the Bayview, not right here, but over in the Bayview, but here in San Francisco. So be on the lookout for that information as well. Bring your friends, bring your families, bring your cousins, bring your teacher from 6th grade if you want to, if they're your favorite teacher. Whoever you can get to this event is always awesome. As we said, as we move forward, I definitely agree with Andre. It takes an individual to change the community, takes a community to change the nation, takes a nation to change the world. And right now in our communities, we definitely need to come together so we can start building change, because this nation desperately needs it. So if you want to be the change, start acting, start doing, start talking, educate yourself. That's it from me. It's been a pleasure. Kimball Torres signing out. Have a wonderful afternoon, everybody, and we'll see you next time.